So you've been diagnosed with shingles. Here's what you need to know and a little bit about what you might like to know. So likely when you were a child you had chickenpox. You got better and you thought everything was fine, and it was, but actually the virus that causes chickenpox doesn't leave your body. It actually lives in your spinal cord, and it stays there dormant for many people the rest of their lives, and for about 20% of people it comes back out later on, many years later. And what happens is that it leaves the spinal cord via one of the nerves that comes out of the spinal cord. So what happens is you get pain along the distribution of a nerve, or where the nerve is perhaps falling down your arm, you get pain for a couple of days, and then you get a very odd rash, a lot like chickenpox, with these little vesicles in that area. And that's what shingles is. Now, because the virus is inside the nerve itself, and the whole point of a nerve, the job of a nerve is to transmit sensation and pain, it's extremely painful because the infection is inside your nerve. So it's not surprising it's going to be very painful, and you'll probably be given some kind of medicine to manage the pain. If the pain lasts for more than a month, we call this post-herpetic neuralgia, and it can happen usually in older folks, and it can last for a very long time and be very, very difficult to handle on a daily basis. It drives many people crazy, but it usually does resolve completely within 6 months, so that's the good news. If you've been given medicines for it, do fill them as soon as possible. The sooner you get them into your system, the faster they're going to work. You should also know that you are contagious while you have those vesicles. So you really want to avoid pregnant women as well as patients who are taking chemotherapy, because they can catch this from you, and you can also give anyone chickenpox who hasn't had it. Those vesicles are no longer contagious once they pop and dry over. Once you got a crust on them, they're not contagious anymore. But in the meantime, do cover up your vesicles with lots of clothing, or put a bandage over them to make sure that you're not transmitting it, particularly to pregnant women and people on chemotherapy. If it's itchy, you can try some calamine lotion or some oatmeal baths. Some people do find the itch is almost as bothersome as the pain. Do see your family doctor within 1 to 2 weeks just for follow-up to keep an eye on it. If it's getting more and more red around the area, it may be infected and you need to get antibiotics for that. So see your family doctor right away for that, or you can come to the emergency room if you can't get in. Alternatively, you do want to make sure that it stays nice and dry and clean as best you can. I'm Dr. Atzema, and those are my discharge instructions for shingles.